Does sutureless gastroschisis leave us with more periumbilical hernias? Hi, I'm Cecilia Gigena from Cincinnati Children's Hospital, and I think this is an article that you should know about. This is a retrospective study from the Midwest Pediatric Surgery Consortium. They follow up patients that had gastroschisis and underwent closure between 2013 and 2016. And what did they find? They follow up 375 patients. The overall rate for periumbilical hernias was 22.7%, and it was significantly higher in those who underwent a primary closure versus those who needed a silo. Patients who underwent sutureless closures had 50% rates of persistent hernia, but only 16.4% of the patients who underwent a sutured closure had a persistent hernia. Spontaneous closure was seen in 38.8%, and only 31.8% needed a surgery. So it seems that even though sutureless closures lead to more periumbilical hernias, they can be managed as any other congenital umbilical hernia, and they had no additional risk. Stay tuned for more articles that you should know about.